Hi SP Fam, Kalmusta? I'm Aussie Perfecto, Managing Editor of Smart Parenting and your resident Kalmama. Join me as we learn together and embrace the different stages of motherhood from pregnancy to parenting. The physiological and hormonal changes of pregnancy are unique. For some, this brings out the pregnancy glow, and for many, it manifests in darkening of armpits and the neck. For me, I got eczema, which made my skin very itchy. I started scratching and it left dark marks. For skincare during pregnancy, I'd like to know what creams I can use and what ingredients to avoid. To find out more, let's talk to a dermatologist, Dr. Michelle Inhente Taplante.
Most women have more sensitive skin, especially when they become pregnant. This is because of the metabolic and hormonal changes occurring in their body. Sometimes they would have more pruritic skin or more itchy skin. It could be more sensitive when it becomes more red, and they would have some burning sensation, or the skin would become a bit dry. So during this time, it is advisable for the pregnant women to avoid strong chemicals and fragrance in anything that they apply, like soap and lotion. So when you use products with a lot of fragrance or dyes, colors, this increases the sensitivity of your skin. Most of the skincare lotions and creams that are available in the grocery or pharmacy that are over the counter are usually safe in pregnant women. Some of the products that are not safe for pregnant women are medicines for acne, such as tretinoin. There are also oral medications which are not safe in pregnant women, and it is important that we ask our obstetrician and dermatologist for the safe medicines to use and for the right medicine for your skin type and skin problem. It is important to look at the skincare products that you're using, especially the ingredients, because there are some products that can be harmful to your baby. So there are some products that can get absorbed to the womb. Another important thing that we should watch out for are oral medications, especially the medicines for acne. There are medicines that are teratogenic, meaning it can affect the birth of your baby. Women have more sensitive skin during pregnancy. Even if you don't have a history of eczema, and all of a sudden during pregnancy, they would have eczema. There's a skin condition called atopic eczema of pregnancy, and it is only during pregnancy that you develop this kind of skin asthma. In case this happens, as much as possible, try to use mild soap and lotion. If it doesn't improve, make sure that you consult with your obstetrician or dermatologist so that you'll be given the right topical or oral medication. Stretch marks is one of the common problems during pregnancy. This is because of the sudden increase in abdominal girth and also on the hips and even the breasts. Genetic factors and family and personal history are strong predictors if one would have stretch marks. Different studies show different results. Some show that the creams work, and also the massage increases the blood flow on the skin, thus lessening the chance for stretch marks. During pregnancy, because of the hormones, there are a lot of areas that can become dark, like the underarms, the inguinal area, and even on the abdomen, which is called the linea nigra. So because of the hormones, we can't stop the hyperpigmentation from happening. Eventually, after giving birth, it can lighten with time. And usually because of the decrease in hormones, it usually normalizes. Getting pregnant is a very beautiful time during a woman's life. So during this time, you have to feel very beautiful because you're carrying a baby in your womb. During this time, you should do things that will make you happy, like spending time with your friends, exercising if your pregnancy is not that delicate. Whatever changes that may happen during pregnancy, like the darkening of your skin, the stretch marks, these are marks that will eventually improve or become less visible.
On the mama calendar, we are now in week 20, and the baby is the size of a mango. For me, I can start to feel some movement and even feel like the baby is responding to my voice. Want to know more about your baby's development in the womb? Subscribe to Smart Parenting's Pregnancy Tracker and track your pregnancy week by week. For today's Kal Mantra,
I love my pregnant body. It's radiant, beautiful, and blissful because it's equipped with everything I need to take care of my baby.
thank you for joining me today. See you again Tuesday, 6 p.m. for another episode of Kalmama, where we keep calm and mama on. Bye!